All right. Hello, everybody. I'm here with Miss Margie from the Lake Worth Clinic with our company, and she is here to talk about picky eating versus what would be considered more of problem feeding. So, Miss Margie, you may take it away.
Right. Thank you, Teresa. Yes, my name is Margarita Avila, and all the kids call me, and all my coworkers and friends call me Margie. I am a speech language pathologist, and I'm also the director of the Lake Worth Facility for Progressive Pediatric Therapy. I have almost 20 years experience in my field, and I feel blessed every day to do what I do. I love what I do. I love helping children reach their potential and helping parents collaborate with them on how we attain this. Along the way of my profession, I focused on a few areas that really interested me. One of them was feeding. And I remember the first parent that brought me a child, and I could hear the concern in her voice. And as a parent, I understood how frustrating this is and how concerning it is nutrition wise. And so I started to research a lot about feeding difficulties and disorders. And I was fortunate that my undergraduate was in behavior modification. So I applied both what I learned in graduate school as a speech language pathologist together with behavioral techniques to work on children that have challenging feeding behaviors. So as I started to see parents in the clinic, I would hear a lot of times that, parents are concerned, of course. They didn't know that there was something that could be done for this. They didn't realize there was feeding therapy. So I felt fortunate that I had the ability to educate parents and teach them. So I put together a little PowerPoint to help support what I'm going to talk to you about today. Let me get that up. All right. So what I really wanted to cover was the difference between picky eating and a feeding disorder or difficulty, and understanding the difference. There's a lot of gray area in here. And, we could say that every child is picky. So let's talk about the foundation of feeding. What are the developmental stages of feeding? The American Academy of Pediatrics recommends introducing foods other than formula and breast milk around the age of 6 months of age. Now, this is give or take a little bit. There's a little wiggle room in here because every child is so different. And you want to be aware of what are the clues that your child is giving you that they are developmentally ready for the introduction of foods. You want to see, can they sit with little or no support? How's their head control? These are very important with feeding. And is the child opening their mouth? Are they leaning forward? Are they interested when food is around and is offered? So here's a video, a short video of a 6-month-old who's just been introduced recently to food. So I want you to see what is typical. He's got that suckling. You see his mouth opens when he sees the spoon coming. He's leaning toward where the food is. He's searching everywhere. He's learning about his environment. Oh, mouth opens. He sees that spoon. There it is. He opens his mouth again. And you see how he leans in just slightly because he sees that spoon with food coming. So this is what typical children do. See that mouth opening up? He's excited to see that food. There we go. So that's a typical feeding with a 6-month-old. Okay, so these are some things we want to keep in mind. We want to know when their oromotor development is ready for the next transition in transitional foods as you go up in textures. And what I mean by oromotor development, around 4 months of age is when they start gaining some more head control. Their jaw and their tongue move forward to prepare to transition from a bottle or a breastfeeding to a munching and accepting the spoon and processing more of a puree. Around 7 to 9 months, you get more of that lip closure. If you noticed with the video I showed, mouth was open, had that suckling on his tongue, so he wasn't getting that lip closure yet. And then you'll start seeing his lip or the child's lip being used to scrape off the food from a spoon. And then the tongue starts doing this lateral movement where it's moving that food from side to side. So you're getting more range of motion with the tongue instead of that we saw in the video. You want to try one new food at a time and allow 3 to 5 days between new foods to see if your child has any problems with that food, such as a food allergy or intolerances. And you want to have in the back of your mind and know your family history. Does anyone in the family have any food allergies or intolerances? That's not to say that the child's going to have a food allergy or an intolerance, but you want to have that in the back of your mind, and you want to allow for those 3 to 5 days to make sure that that child can tolerate those foods. I get so many kids that come into the clinic and they are given these mixed, I know all the baby foods like to mix avocado and pears and string beans and all these things together. And when a child starts with that and they are having a difficulty, I'm not sure if that's part of the cause. So now we have to backtrack. So it just makes life easier if you just start off with one food and make sure that that's good. Start off, then add another food, make sure that's good, and then you can start getting those mixed baby foods. Keep in mind that food is multisensory. They're dealing with textures, they're dealing with different temperatures. There's the flavoring, the different flavors, they're smelling this food, and there's all these colors. So these are all new things. These babies are learning and taking in so much information, and this is part. Look at all the different things that they are processing when they're dealing with food. These are some strategies to help you through the developmental stages of feeding. You want to give infants teethers that help them experience different textures. The teether that I put at the bottom, I don't know if you can see it real well, but each one of those has a different texture on there. You want to let them explore it. They're going to put it in their mouth, put it in different areas of their mouth. And that's important. That helps them get ready for dealing with the different textures that they're going to start experiencing as we start feeding them. You want to let the child explore spoons, holding the spoon, bringing it to their mouth, playing with it, putting it in their mouth. Of course, you want to keep an eye on a baby every time they're doing this. And then when we start exposing them to food, let them get messy with the food. Put that food on their tray, let them play with it, Jell-O, yogurt, all those soft foods that have different textures, noodles. Let them get messy with it and explore it. And have your child be present at a meal time. They're learning habits. They're watching everything we do. So they're going to watch us sit at a table or wherever it is your family sits at a table to eat. And they watch, what are we doing? That's why when a child starts getting a spoon, they start bringing it to their mouth. A, they're exploring it, but B, they've been watching us do that. And as you saw, this 6-month baby that I showed the video of, every time he saw that spoon come with the food, his mouth would open up because he's been watching us do the same thing. So we want to establish those habits from the beginning. I get a lot of parents that are frustrated and they say, well, they don't eat with us, but they never expose them. They never started that habit. So let's set them off on the right foot by establishing that habit from the beginning. Be aware that between 6 to 12 months of age, babies are more open to new foods. So we want to introduce them to those little flavors. You know, stick your finger in the yogurt you're eating or the pudding or the different foods that we're eating, just to let them be exposed to those flavors. Okay, so picky eating. Picky eating is very common. I would venture to say every single parent has said, my child's a little picky with eating, or very picky. So it's common. All kids experience this. And you see this picky eating start to emerge around 15 to 18 months of age. And around that same time is when children start learning their autonomy and their control. So they start learning they have control and they can self-govern themselves. So they're going to exercise that. And also, the less pressure we put on a child, the more likely they are to change their behavior. As they're developing that self-autonomy and we're sitting there insisting, they're going to start pulling back. So the less pressure we put on, the less fights we're going to have and struggles and frustration on both parts. Okay, so let's talk about signs that this picky eating is really a problem. You want to see how many foods is your child accepting. If they accept less than 20, 15 to 20 foods, usually the kids that I see are only accepting about a handful of foods. So if their inventory of food is that low, I would be a bit concerned. Is your child melting down or refusing to eat preferred foods if that non-preferred food is on the same plate or on the same tray? A lot of times I'll have a child that their favorite food, let's say, is chicken nuggets. Those chicken nuggets are on the plate, but the minute you put a non-preferred on there, whether it's a strip of chicken, real chicken, or broccoli or anything, they shut down, they melt down, and they refuse to eat their preferred food. If you have any gagging or vomiting with exposure to new foods, smelling, tasting it, that's a big concern. I've had children that will gag or vomit just when mom's cooking. So mom has had to stop cooking in the house. I've had children that gag or vomits watching other people eat. So that child was not able to eat with the family because they had a huge issue every time. So these are things that you want to be concerned about and know that we have therapy and ideas and strategies to work with this. Does your child almost always eat different food than the rest of the family? I'm not expecting a child to eat everything your family puts on the table. That broccoli casserole, that green bean casserole, they're probably not going to eat it. However, you want to see that they're eating some of the things that are put out on the table and they're willing to at least try it. So a lot of the kids that I get in the clinic, the family will tell me, we make dinner, everybody, all the other kids eat what's made for dinner, and this child is eating soda crackers. Let's see, if the child refuses foods from a complete category, a lot of the kids that I get will not eat any meats, no meats or no proteins. I have some that purees are an issue. I have other kids that a mixed consistency is an issue. So maybe they'll have broth from the soup, but the minute there's any little piece in there, that's an issue. I've had parents that have discovered, well, my child will eat this stew that I make if I puree it really well. But the minute there's a little chunk or a little fiber, I've got a child gagging or vomiting or refusing, crying. Okay, here's some more signs. Child shows signs of anxiety with food and eating. They're scared of food. I get a lot of parents that'll tell me, I just feel like my child is scared of food. Or my child becomes very anxious when mealtime is coming or I'm preparing food. You know your child better than anyone else. A parent is the expert of their child. So you know what anxiety or scared looks like with your child. Let's see, child does not eat with the rest of the family. Most of the kids that I'm dealing with, they usually have to be fed before the family eats dinner because it is such a battle, such an issue that the rest of the family cannot eat. I have children that will only eat with a specific plate, spoon or fork, or a cup. I had one child that had only it was like a sippy cup with a specific top that he had it all chewed up where it was just an open, area that this blended, like really thick puree could come out of. And the family was really concerned and excited at the same time because the child would go to school with this specific vessel for its food. And one Friday, it was not returned. So the family thought, oh, well, great. He'll have to eat something. We'll give it to him with a spoon or something else, and he will eat. And what happened was the child did not eat a thing the entire weekend. So they were concerned that might happen, but they thought for sure the child's going to eat, and they didn't. Does a child melt down or tantrum during meal times? Is that the norm? Or when a new food is presented? I have children that will drop on the floor, that will cry, pinch, hit, scream, hide under a table, run out of the room. Is that what a mealtime or presenting a new food looks like? And then, is your child very specific to certain brands? I have parents that come in a lot and say, oh, they love chicken nuggets. Oh, will they eat chicken nuggets from every place that you go to, McDonald's, Burger King, restaurant, the frozen ones we get in the store? Oh, no. Only Burger King. So those kids that are very specific to brands of food, and I find that kids are I say their taste buds are very smart. I have parents who say, you know what, my child loves pizza, but it has to be the pizza from Costco. So we keep the box and we try to put other pizzas in there, but the child still knows. So even though you change up a brand, I've had parents that their child will eat Fruit Loops, and when they bought the store brand as opposed to the Fruit Loop brand and put it in the same container, child stops eating it. So you want to be aware of that. So what do I do if I feel my child is an extremely picky eater? This is the one that we're really concerned about. This is not the typical picky eater that we've been talking about. First of all, you're going to talk to your pediatrician, and you want to ask for a referral for feeding evaluation. If your pediatrician wants to wait and see, follow your instinct and insist on a referral. I get so many parents that say, I've been talking to my pediatrician and I've been telling them I'm really concerned. They keep saying, oh, it's just a phase. That's normal picky eating. Let's just wait and see. With some things, I agree. However, you're the parent again. You're the expert in your child. Follow your instinct. If you feel, wait a minute, this is not the norm, something's wrong, get a referral for a feeding evaluation. And a feeding evaluation, it consists of a therapist observing a child's reaction to non-preferred foods, eating a preferred food, and we also interview the parent. It's not invasive at all. It's not scary. We try to make it fun. I like to see, what do you do? So I let the parent lead that part of the evaluation so I can see what is typical here. How are you presenting the food? What's going on here? So just know that it's not invasive. It's not a scary thing at all. And we can tell you, yeah, he could benefit from a feeding therapy, or you know what, we'll give you some strategies then. And I've had parents that I've done the feeding evaluation, I've given them strategies, and they've called back once it was time to schedule the appointments and say, you know what, I took all the advice you gave me and I don't think I have a problem anymore. And that's what our goal is. And also know that this feeding evaluation, we have occupational therapists and speech therapists. We're both trained in this area. So a lot of what we do overlap. There are certain areas of feeding that OTs specialize more in, and there are other areas of feeding that speech therapists specialize in more. And we can make that determination once we do the evaluation to see which avenue is the best way for your child, because every child is so different. Okay, so last slide. Food is fun. We want children to know that food is fun, and this is around think about all the things that we do in life that we revolve it around food. Think about just our daily meals. Beyond our daily meals, we decide to go to the beach and we pack a picnic. We pack food to go. We have birthday parties. We have celebrations. There's always food involved. I mean, just us as adults, we think of a meeting, we're like, who's going to bring the cookies? So think about all the things we do in life that revolves around food. And food is fun. You don't want this to be something that carries over later on in life and becomes an issue their entire life that they're struggling with. I had a child come in a few months ago, and mom told me, well, grandmother has a feeding issue. And she showed me a picture. The woman was very, very skinny. And I said, well, tell me about that. She was force fed. So that pressure was placed on her from the beginning, where it became psychologically such an issue that she does not enjoy food. She gets very anxious with all these family gatherings where food is around because she feels like everybody expects her to eat. So we want to avoid that. We want to set up a healthy lifestyles, healthy habits for your child and for you as a parent when it comes to food. All right, that's all I have for today. Teresa was gonna see if there were any questions.
All right, let's see. Oh, I'm trying to. Okay. Margie, do you want to stop your screen share?
Oh, I can do that.
So I don't see any questions so far. I think you did a very thorough job in sharing information about what is typical and when parents should be concerned. So if anyone has any questions, please comment and we can always get to them later. And also if there's any other topics that anyone wants to hear about, please comment that as well. We do have one question that came in.
Okay.
And they ask, should kids be encouraged to use preferred utensils or sippy cups?
Or sippy cups, it says?
Yeah, it said, should kids be encouraged to use preferred utensils, question mark, sippy cups, question mark.
I think options should be given. Hey, which one do you want to eat with today? Keeping in mind that we don't want it to always be that Mickey Mouse spoon. Maybe have a few different ones where we can change it up. And every once in a while say, oh, you want to use mommy's? So that we're not in that that black and white area of, oh, it has to be that one. And then sippy cups, absolutely. Encourage your child to transition to a sippy cup. Use a straw. Change it up all the time. You want to get rid of that baby bottle as soon as possible. I know a lot of times, a lot of parents tell me, oh, but it's so much easier. Yeah, but developmentally, it's not appropriate and it can cause dental issues later on.
All right, thank you for asking that question. We have someone else asked a question, but I'm not sure what they're trying to say. Sandra, if you could please reword what you're trying to ask us. And if anybody else has any other questions, I'll give Sandra a second to see if she can type back in what she's trying to ask. Please feel free to comment. And Margie, actually, here's a question for anyone who's watching who is interested in pursuing a feeding evaluation. Can you share a little bit about what that is looking like right now during COVID?
Okay, so very good question. We've had a few that really want to come into the clinic, and we are open for some patients to come in. I've done a few in my therapy room at our office. We've got everything sanitized. We sanitize between patients, everything, the table, the chairs, everything. We're using gloves, mask, a shield. We do our best so that it's not scary for a child. And I realize that typically seeing somebody come with them with a mask and gloves can be scary. So I do my best to bring out toys to kind of distract from what we have to do to keep ourselves safe right now. We clean all those toys away. I take out very few toys, but enough to like pique their interest. I have some that I'm doing teletherapy. And honestly, I'm doing a lot of the feeding treatment teletherapy, and I have been surprised to find that it's working out really well, because I feel like I'm sitting in the house with you at the table. So it gives me a bigger perspective of what mealtime looks like in your home, as opposed to you bringing your child to me. So I've done a lot of evaluations, teletherapy. Again, I'm in your house doing it. So it's worked out really well.
I've seen that as well. I have a couple kids that I see for feeding, and I'm seeing really, really nice results now that we're at home. So instead of in the clinic. So it's been great. Another question here for Regina. We know Regina. She asks, do you encourage toys where children can mouth or chew on? Could this be an early sign of a feeding issue if they don't like things in their mouth?
I wouldn't think that way. I would give them things to put in their mouth. They're going to put developmentally, they're going to put stuff in their mouth when they're ready for it. So I wouldn't consider that to be an early sign of it. But yeah, encourage different toys.
Yeah, different toys, different teethers. What are they? The taggy blankets. I know taggy blankets are preferred by lots of little babies. Dominique says frustration tolerance, self-regulation strategies for toddlers. So I assume you're asking for maybe some suggestions on
self-regulation.
How to work with toddlers.
Okay, well, here's what I'll tell you. When I'm doing therapy for feeding, I will start out with what is, I'll find out from the parent what is very motivating for the child, because I'm going to use distractors. As I get their mouth used to these new textures and flavors, I'm distracting them with something they really like. It may be we're building Legos. It may be the tablet. Not that I'm a huge proponent of the tablet, but if I'm going to get the ball rolling with getting the mouth ready, I'm going to use that tablet to A, distract them, and B, reward them. I'm rewarding, you just took that bite, great, and I'm gonna shift their mind off of what's just went in their mouth to what's on the tablet, or the Lego we're building, or the cards we're putting down the ramp.
All right, I think that's all the questions for right now. If anybody else has any other questions, get them in, or we will just get to them later. Okay. If anybody is watching this as a replay, feel free to ask any questions and we'll get to it later, okay? Yeah. And please share if there's any other topics that you want to see us do some lunch and learns on. You can put those in the comments as well. And I think that's it. Okay. Thank you so much.
Okay, sounds good. Thanks, guys.
All right. Bye, everybody.
Bye, everybody.